In this study, we were interested in examining the possible association between use of antibiotics during infancy and then risk of overweight and obesity later on in childhood. So we used a cohort here at the Manitoba Institute of Child Health called the Study for Asthma, Genes and Environment, or the SAGE cohort. And so these children have been seen in clinic at ages 9, 10, and 12. And so we measured their height, weight, and their waist circumference, or central adiposity. And then we linked that information back to their prescription records, which are available for research in Manitoba, in order to identify which children received antibiotics as babies. Very interestingly, we found that the babies receiving antibiotics in their first year of life had an increased risk of being overweight or obese later in childhood, all the way into their teenage years. And this was a unique finding, so there have been just a couple of studies in humans showing this association of antibiotics and overweight, but they've only followed the children up to maybe 5 or 6 years of age, so our study goes out much longer, showing that this is a long-term effect. And also the previous studies had never measured waist circumference. So we tend to measure height and weight and calculate the body mass index and use that as a measure of obesity. And that's one way of measuring obesity, but it's potentially not the best way. So studies have shown that waist circumference is a better predictor of things like cardiovascular disease and diabetes. And so we had that additional measure in our study to show really that this is a clinically important association. Antibiotics are commonly used, so many children and infants receive antibiotics, and often there's an assumption that there's no harm to this. It's potentially going to cure them of an infection, and so it's a useful thing to do, right? And there's evidence that especially in infants, antibiotics are used potentially inappropriately. So, for example, if a baby has a cough, comes in to see the doctor, most of the time that's a viral infection, so an antibiotic, which is designed to kill bacteria, isn't going to help that infection. But there's a chance that maybe it's a bacterial infection, so oftentimes pediatricians will just prescribe the antibiotic just in case. And so now with this newer evidence that there's potentially a long-term harm to that exposure, doctors are thinking more carefully about when to use antibiotics, especially in children. And some good news is this cohort that we studied are now almost 20 years old, so they were born in 1995. And we found that at that time, 2/3 of infants were receiving an antibiotic in their first year of life, which is a really high number. When we look at our new child study, which is a cohort of children born in 2010 to 2012, so 15 years later, we're seeing that number is reduced by half, so only 35% of infants are receiving an antibiotic in the first year of life. So we see that as good news and a more, what we would call, judicious use of antibiotics. So physicians are getting the message that potentially we want to avoid antibiotics when they're not absolutely necessary. And certainly we acknowledge that antibiotics are life-saving drugs. They're very important, and they can be very beneficial. We just need to be careful about when we use them because of these potentially long-term effects that weren't recognized before. So from here we're really interested to understand the why. So we've shown that there's an association, so babies receiving antibiotics have an increased risk of obesity, but we don't know exactly why. And in this study, we weren't able to look at that in very much detail because we had the prescription records and we had the body weight measurements, but we didn't have sort of the intermediates that we need to examine the pathway. So in our new study, this child cohort, the Canadian Healthy Infant Longitudinal Development Study, we have children where we know about their antibiotic exposures. We're following them to measure development of obesity. But what we also have is biological samples. So we can look at, for example, their microbiome. And this is one pathway we think might be involved in the association. So antibiotics, of course, are made to kill bacteria. The intention is to kill bacteria that are making you sick, but they also can have dramatic effects on our friendly bacteria or our microbiome. And so what we think is that antibiotics given to babies are changing the microbiome in a way that predisposes them to diseases later on. So either by changing their immune system or changing their metabolism. So we know that gut bacteria train the immune system, and they also help us extract energy from food. So if that balance is disturbed by antibiotics, the long-term effects could be sort of disease of the immune system, so allergies or asthma, which also have been linked to antibiotic exposures, or diseases of metabolism, so obesity or related diseases like diabetes. So we're really excited for the child cohort to have this microbiome data so that we can look at whether antibiotic exposures are changing the microbiome and if that subsequently leads to disease states.